but I use miles.
Testing, testing. Okay, Tace.
Hello.
Diane.
Hello.
Scott.
Hello.
Hello. Okay, I don't know why.
Hello.
Fuck.
Are we doing that story first?
I don't know. I'm just playing it by ear.
Okay. Well, I'll have mine all prepared.
I'm sure you will.
I'll have mine half-assed.
I'll have mine half-assed 3 o'clock if you don't care. Don't even know what that means. What I really want to do is play Bo Daddy Harris.
My story is more just like a tip in the hat to the idiots of the world.
Yeah, no, that's fine.
Yeah.
That's fine. It doesn't matter. Just an
I have
idea
2
I
of
had.
them. And one's my favorite.
It was just an idea.
It was a good one.
Was it?
Mm-hmm.
I like how I had my 30th anniversary, and did you notice one of the, they sent me this. Well, I'll talk about it on the show.
Okay.
It's so stupid. Just so what an asshole, idiot I am. All right, we ready?
Mm-hmm.
Okay, I am sadly turning this off, but as the fall progresses, it'll be better up here. And this,
Allegedly.
are you around this weekend?
Yes.
Do we have anything besides your birthday?
I don't know anything about my birthday.
Well, no, you and I were just going to do whatever.
Okay. All right, then no.
Okay. I was just thinking I could, maybe Friday night I'll go get that thing. Scott could help me install it. Since it'll benefit him more than anybody because I don't care about how hot it gets up here. You guys do.
Me either.
I do. What about the fan, Steve? What about the...
Yeah, go ahead and turn it on.
I can't get it to...
Okay, I'll turn it on. Just don't
You're
do
flat.
anything.
That.
Look,
Oh.
I pushed every button on it the last time I tried to turn it on, and the motherfucker wouldn't turn on.
Motherfucker, your eyelashes are amazing.
Thank you. I use Rodan and Field / Boost. It's expensive, but it lasts forever.
I'm using NuSil, but I have no mascara on right now.
There's a bunch of the generic ones that are supposed to work just as good. I just haven't ever tried them. And that
Where do
may
you
be
get the
one of 'em.
generic ones?
I don't know, but I was reading.
Well, it's $150.
Oh, well, that's not cheaper.
It's a Baji.
That's like the same.
Is it
Yeah.
bougie?
Yeah,
But I'm sure it'll last you for. Obagi stuff lasts forever
I
too.
hope so.
Yeah, it will.
I need to see if it's blowing on your mic.
No. It's perfect.
You should turn it off just to be safe.
Your wife is hot.
Yes, she is.
He bought me
So
stuff to keep my
hot.
face from sweating today.
Did you put it on?
No.
Oh, you should
Oh,
try
I
it.
should have brought you
Put
something.
it on half of your face and see if it works.
I should have brought you
It's not a
something.
bad idea. You've got stuff for hypo.
Give yourself a bill.
Yeah.
Fuck, Scott, really?
Oh, God, yeah. You kidding me?
Scott,
Yeah.
just go to Scott.
Hey, we've had the Chinese people have been treating hot flashes for thousands of years.
Sure.
thousands.
Literally.
All right. Ready?
Do it.
It's time for Weird Medicine
God
with
damn it.
Dr. Steve.
Hello? Huh? Oh, yay. Good. Yay. That's awesome. I know. Okay, well, that's good. The main thing is the percentage. But anyway, yeah. Okay.
Do you have things for thyroid?
Not really.
No,
Just
seriously,
thyroid Medicaid.
What do I need to do? Make an appointment with you?
I'll just bring you some.
Yeah.
You need to go make an appointment. And come see me.
Yeah.
They can come in to see me? Oh,
I'll
yeah.
send
No,
you
that's
some.
fine. Yeah, of course.
I do.
You don't have to ask.
You really have stuff?
Oh, gotcha. We've used it for years. Literally.
Thousands.
Scott, I'm dying.
I didn't know that.
No, if there's a space in the
I
schedule,
don't
you can
know,
put them
I
in.
swear.
Yeah, for
I'd
sure.
I'd have done it.
Yeah. Yeah, just make
Oh.
sure that it goes on the correct schedule, because if you put it
Wow.
on my schedule, there you go. Yeah, that's where it needs to go. Yep.
You
Okay.
still have 'em,
Or
period?
lack of thereof.
No, we're going to make you have one, no.
It won't make me have one.
Yeah, just I don't care.
No.
I mean, God forbid
No,
that I ever
no.
eat lunch. You know, everybody else, never mind.
Hey.
Someone's getting bitter pitter
no,
over
it's-
there.
Can you imagine them asking a cardiologist to just skip their lunch?
No.
No, but anyway, that's okay. Don't worry about it.
They assume he does already because he's so skinny.
No.
Yeah, well, I can do it by telehealth. I can't do it by phone. So they have to have either a home health nurse out there with a tablet, or they need to have smartphone with internet access. One or the other. Yep. Okay, thanks. Okay, bye. Okay. Friday's gonna be a treat. All right. Sorry, everybody.
Then you get to come home to.
Joy.
To your birthday.
Joy and happiness.
That's true. All right, here we go. Oh, for fuck's sake. Recording on the wrong track. There we go. Why is it
If
doing
I'd have
that?
known it was your birthday, I wouldn't have gone to Florida.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. The longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott. Traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we have Lady Diagnosis back from sabbatical. Hello, Lady Diagnosis.
Hello, Dr. Steve.
And we have my wife, Tacey, my partner in all things. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician, assistant, pharmacist, chiropractor, acupuncturist, whatever. All right, very good. Both welcome back, Lady Diagnosis.
Thank you, Dr. Steve.
So I
it's great being back.
Yeah, so you just kind of took off your job because you told him I'm quitting anyway, so I'm just leaving whenever the fuck I want. Is that what happened today?
Well, I said I had a dentist
Hopefully they
appointment.
don't listen, so that's good.
But yes, I am here.
I mean,
Come hell or high water, I was coming.
statistically, it's probably a pretty good bet that they don't listen.
No.
Right,
they don't.
Tace?
Yes.
Okay. And then
If they have any sense.
Tacey's birthday is coming up.
Yeah. So is
Happy
yours.
Oh.
Sign up for our Patreon at
Yes, as a birthday
patreon.com/weirdmedicine for Tacey's birthday.
That's
Yeah.
what she wants.
It was
And his.
originally designed to help Tacey get to retirement, but then she got retired
I got
by accident
retired. Yes.
early, and so now if you want to, And actually, somebody sent me something the other day that said they love the Patreon show because it's so different. So do check it out. Patreon.com/weirdmedicine. Check out Dr. Scott's website. It's simplyherbals.net. Got anything interesting going on there, Dr. Scott?
Only the world's greatest nasal spray.
Okay. Okay, that's not an advertisement.
No,
but
it's
do you
not.
want to talk about what's in it?
It's just a natural.
Can you move your mic a little bit?
It's a natural nasal spray with honey, baking soda, salt, and a little bit of peppermint oil.
Well,
So
hell,
it's-
they can make that at home.
They can. They sure can.
Well, they can, but
But they won't.
Yeah.
if you do it with tap water, you could be
Packaging.
spraying amoebas up your
Oh.
nose.
Yeah, and you got to do it kind of in the right proportions because a little bit too much peppermint oil goes a really long
yow.
way. Yeah. So that's the main thing we've got going on.
Yeah.
Thank you. Yeah. So thank you. Yeah. And right now's the time.
Well, what
of
about
season.
the CBD though? Don't you have one with
and
CBD?
we
as
do
well?
have one with CBD oil also. That it's been shown clinically to block certain viruses from attaching inside the nasal passages. Now, I'm not saying mine does. I'm just saying that I've seen it in writing.
Okay, you've seen it in writing.
That's all I read on the internet.
Graffiti on the side of some
I
building.
read it on the internet.
CBD's good for.
Yeah.
No, but I would
Yeah. It's excellent stuff.
be very interested in seeing that. I just think CBD in general would be good for.
It's a
that's
great
good-
anti-inflammatory.
It's a good route for CBD if you're into that.
Yeah.
But anyway, I don't know about all these other claims.
No,
you're
I'm not making any claims. I mean, now it's been scientifically proven to be the best nasal spray in the world. Oh yeah.
Okay.
I've
Oh,
proven
God.
that
Okay, that's
repeatedly.
Dr. Scott saying that. Anyway, yeah, we better shut up or we'll
Yeah,
get in
we
trouble
will.
for
Move on.
doing
Move
an
on.
ad. But anyway,
No ad.
yeah, and I want to say happy birthday to the owner of our network, Mr. Cardiff. It is his birthday today, so happy birthday, sir. All right. Do you guys know anything about No Nut November?
No.
Nope.
Okay, well, there is this thing
Nope.
called No Nut November.
Do you guys know what month it is? It's technically No Nut November.
Well, okay, so it's not right now that when
I
she
was
recorded
confused
this.
for a
I know.
second.
Yeah.
Do you know what day this is, Steve?
So it's September, October. We've got a couple of months to prepare for No Nut November.
Funny.
So,
I'm Dr. Rena Malik, urologist and pelvic surgeon, and I'm finally going to talk to you guys about No Nut November or semen retention.
no, thank you.
No.
No, thank you.
It sounds like a great idea to
Hold
me.
on to that semen.
Yeah. I had No Nut 2020.
Oh,
and
shut up.
21.
Here I talk about all sorts of things: sexual health,
Okay.
urologic health, bladder health, and much, much more.
Okay.
Make sure if you like
She has 3
Who
million
is
views.
that? Oh,
So I'm not crapping on her. She's obviously very successful.
Every
you
housewife
subscribe
in
and share this
America.
channel with your friends.
Okay, enough. So, anyway, I just wanted to see if she said anything about the health benefits of not doing No Nut November, because there are studies that show that people who ejaculate frequently actually have a decreased risk of prostate cancer. But I believe that the number of ejaculations per month is something like 21 a month. So.
that's excessive.
Better get busy.
So what they're talking about
Got
is
some tendinitis.
18-year-olds. No shit, they don't get prostate cancer. Good lord.
Exactly.
Let me see what she says here. Okay, let's see.
So what do I think about semen retention or No Nut November? Well, I think if you're getting benefits from participating in No Nut November, like you're feeling more clear, you're having deeper relationships, you're feeling like you're more excited about being with your partner.
Well, that is something.
Or
and-
if you're less depressed because it's intentional.
right. Oh, I'm doing it on purpose. I do think that she brings up a good point here, where she said, "Well, you're feeling like you're more excited about being with your partner." I have people that will call me or write to me saying I'm no longer as attracted. I have difficulty performing with my spouse or my longtime girlfriend or boyfriend or whatever, but I don't have any trouble masturbating. And it's like, well, then stop masturbating, because if you want to be excited about doing it with your partner, you got to quit beating off in between, because nobody knows how to manipulate, and this is for guys, nobody know, and it's true for women too, nobody knows how to manipulate your junk like you do. And it's a whole lot easier to bust a nut when you're doing it yourself than it is when you're sticking your penis somewhere in your partner's orifices or whatever, because they don't have the control over your junk that you do if you're masturbating. Does that make sense? So sometimes people, Bob and Tom used to say, Casey and I used to listen to that every morning at 6 in the morning. They used to say, show me, a beautiful person, and I'll show you someone that's tired of having intercourse with them, male or female. So, but part of this is people beat off a bunch in between time and then try to have sex with their partner that they've been with for, 10, 15, 20 years. It's more difficult, and the older you get, the more difficult it is. So stop beating off and save it for your partner, and then the next thing you know, you'll realize that you're still hot for them. It's just that you're not beating off is too easy, So, anyway,
Well, there you go.
that's all. So, Bust a Nut November Bust a Nut November is what I would like to do. But anyway, all right. That was all I wanted to talk about on that. Do you guys? We were going to do stories. We are going to try something new, and I don't have a theme song for this. But you guys were each going to bring a gross medical story, and I will be perfectly honest. I'm ripping this off from Shitty Song of the Week, where they do this, and also the Creep Off podcast.
I didn't want to say anything, but
No, I'm ripping it off from them.
And
they ripped it off from
Somebody else, yeah.
every other show where you vote for something. But I want you guys to bring a creepy or gross medical story, and then people will vote on it. And if we have a winner, maybe we'll do something. The Creep Off, which is Carl and Vinny, they do. It's a comedy true crime show, and they have to bring the worst creep in some certain topic, and then everybody votes, and if you lose 5 times, you have to spin the wheel of consequences, and the wheel of consequences is always something you don't want to do. So I don't ever want to spin the wheel of consequences, so I would prefer that we not do that. Maybe we'll do something more positive if somebody wins, rather than doing something shitty if somebody loses. But I'm going to tell you, people will be more interested if there was some having to do some embarrassing
Skin in
shit
the
on the
game,
line.
yeah.
Yeah,
Yes.
they would be more interested.
Of
So we'll
course.
see. Well, we'll try this and see. But anyway, who wants to go first? Let's let Scott go first, and so we'll go counterclockwise.
That sounds like one of those deals when you're standing in line and anybody wants to go first, just step forward
they'll forget about
and everybody
you.
steps back.
Yeah.
Yeah,
Yeah,
and then you're just stuck.
and you're
there
stuck. It's like, okay.
like an idiot.
All right,
That's
I
always
found
me. Okay, what do you got?
I found one. It's the largest or longest tapeworm ever removed from a human being.
Okay, you win.
Yep.
Phew. Okay.
So this dude, this
By the way, Google image that
Yeah,
if
this
you
dude-
want to really be grossed out.
this dude living in India, God bless him, he started having.
It's hilarious.
He started having.
Jesus, this
No,
poor guy.
no, I'm not laughing at him. I'm just the poor guy. He starts having.
Man,
He has for years
you
and
are
years.
one pathetic loser.
Okay.
He for years and years is having abdominal pain.
Yeah.
and they're having trouble really identifying where the abdominal pain is coming
Probably
from.
having difficulty gaining weight.
Well,
too.
then he starts losing more and more weight, and he becomes anemic.
Okay.
And so now they're starting to really get interested. So they pull this out of his stomach,
They pulled it out of his stomach or
Yep.
out of his colon.
the entire thing, colon,
really?
stomach, everything.
Just kept going.
82 feet
Oh,
long.
What
my
the
God.
fuck?
82 feet long.
Yeah,
Oh
you
my
might
God.
win.
That's
That's
pretty
way better
thin,
than me.
That's
Wow.
disgusting.
That's impressive.
Wow.
That's a hell of a worm.
Wow.
Yep. 82 feet. Yep. Y'all can
Okay,
y'all
you
can take
win.
your shit home. I'm the
All
winner.
right.
Yeah.
What do I have
So
to do?
tapeworms.
Winner.
Tapeworms have a really weird life cycle. Obviously, they are parasitic. We call them cestodes, and they're found in the intestinal tracts of their final host. So that's called the definitive host if you're a biology major. And each adult tapeworm has a head. It isn't even a head. They have to have a different word for it. It's called a scolex, and it looks just like what you would think the word scolex would look like. And that attaches the tapeworm to the intestinal wall, and then it's got a neck, and then it's got all these segments that develop from the neck regions, and you can shit those out too. And as these new segments are formed at the neck, the older segments are pushed back, so it just keeps going. And they're hermaphroditic. Each segment has 2 sets of male and female reproductive organs. And they'll fill the segment with fertile eggs as the segment is pushed back from the neck. And when the segment's full of eggs, it attaches itself from the adult tapeworm and is passed in your fecal matter. And then if some poor bastard ingests your tapeworm eggs, they hatch, and then they migrate out of the intestine into various tissues of the body, and that can cause cysticercosis, and that's nasty as well. So, the tapeworms are just disgusting. And like I said, Google image this tapeworm, and you'll be horrified that this could live inside of you and you not know it. Okay, so that's a good one. I'm going to say, Scott, and will you keep track of these too? Because I got to put it up on our Reddit. And we'll put a poll on there. And go to our Reddit. It's Reddit/r/Dr. Steve, I think. Just Dr. Steve. Okay, your turn, Diane.
Okay. So this man started developing nausea and yellowing of his skin and was vomiting blood.
Okay.
So he had magic mushrooms ground up and made a tea of it. But he injected it.
Yes. We did this story. But this is still a good one. The fact that you found this on your own,
it's good.
It's still good. Go ahead. There's lots of people who hadn't heard this.
So he had fungus growing in his blood.
Yep, and it was magic mushroom.
And 22
fungus.
days it took for him to in the hospital of IV antibiotics before he was better. But he did live. So.
Yeah.
But that,
Yeah.
mushrooms
Just
growing
eat
in
'em.
his blood.
Yeah, just eat the
Just
damn
eat
thing.
'em.
Stop doing
Oh,
stupid
come on,
shit.
You don't have
man.
to snort
You
stuff.
don't have to snort
Drink
it.
it or eat it.
Just eat it. Drink it.
Yeah.
Down the hatch.
Yeah.
It'll be fine.
Well, and okay, we're not. By the way, we're not encouraging illicit drug use, but
No.
oh, we're talking about mushrooms in general.
I was
That's
talking
right.
about
General rule, As a
wine.
general rule.
Mm.
As a
people,
general.
we have these videos of people taking thimblefuls of vodka and putting it under their eyelids,
That's stupid.
which it will be absorbed, but that's an asinine way to have a drink. Number one, there's no taste to it. It will burn your cornea, and it's not enough to really get you off. So just drink the damn stuff, but drink
Yeah.
responsibly.
Yeah.
We had a story where someone died from giving themselves a champagne enema, and because they did 2 bottles of champagne, it was all immediately absorbed through the colonic mucosa. Because when you're drinking, you're pacing yourself, and if you get so drunk that you pass out, you just stop
That keeps
drinking.
you from, dying.
But when you take 2 bottles of champagne and shove it up your ass, you can't control the rate at which it goes into your system. This person also was doing what was it? Autoerotic asphyxiation. That didn't help any either.
Ooh.
So they found them with acute alcohol intoxication, and they had passed out while they were doing autoerotic asphyxiation, and so there was that. Now, the other gross enema thing, and I'm not going to put this up as a contender, but when I was a medical examiner, I got this magazine called the National Association of Medical Examiners. It was named, and they had this journal that was just full of one gross death after another. I mean, it was just unbelievable. They loved it. Just page after page, pictures of people who'd gotten run over by a 18-wheeler, and just stuff like that. And there was this one story that stuck with me, that this person gave themselves a concrete enema. Now, why you would do that, I do not know, but they gave themselves a concrete enema. What people don't realize, that don't work with concrete all the time, is the reaction that that causes concrete to crystallize is what we call exothermic, which means it generates heat.
Lots of heat.
So this person basically cooked themselves from the inside,
Oh.
and they died. So don't do stupid stuff like that. If you're going to use concrete, make a sidewalk out of it. If you're going to eat mushrooms, you should eat them. Don't inject them, and that's any kind of mushroom.
Right.
Not just magic mushrooms. And if you're going to drink alcohol responsibly, drink it. Don't shove it up your ass or put it in your vagina or under your
Drop it in
eyelids or
your
any of
eyes,
that.
yeah.
Just
Right.
drink it. God.
Yeah, this guy had organ failure.
Yes, because he had.
Oh my
What
God.
happened was, the mushroom is just the sexual organ of the fungus. The fungus can be the largest living creatures in the world are fungi, because they can span acres and acres and acres of land. And the mushroom is just the sexual organ. So the thing that he injected actually had spores in it, and then the hyphae forms, which are the growing sort of, just Google image hyphae and you'll see that look like networks of things. Got lots of little arms and stuff like that. And they're not arms, but it looks like it, tendrils. And that's what was growing in this person's bloodstream.
Right.
And it doesn't make the hallucinogen, only the mushroom, the sexual organ, does
Right.
that. And so these things are, it's just a fungus trying to grow, and it's growing in your bloodstream, feeding off the proteins and the carbohydrates in your blood. And that's always a bad thing.
Terrible idea.
And so you have to take often some really horrible, mycofungin is a drug, amphotericin is a drug. All of these are geared at getting rid of these single-celled organisms that are more advanced than bacteria. So it's harder to kill them, and they're much closer to our types of cells. So what ends up happening is those drugs make you very sick, on top of you already being very sick. So that was a good one, Diane.
Good one, Diane. Very good.
All right.
Thank you.
Very, very good.
What you got? Yeah, we'll give you one of these. All right, Tacey, what you got?
Okay. First, I would just want to say that I really appreciated the homework assignment at 10 a.m. this morning.
Okay, what time is it now? 4:30? Yeah,
I
so
had a
6
lot to
hours
do
ago.
today.
She had a big day.
What? Really? What'd you do?
I took a nap. I scheduled a flight.
Oh.
I
Oh,
worked
sorry.
out.
Oh. Very, very, very good.
I love that. Okay, so my story is I'm very bugophobic. So this is all it took, and I was like,
Okay.
okay, found my story.
Okay.
Okay, and it's basic. It's very basic, but it's very disgusting. And it's just bed bugs. So this is the story.
Oh, God, I can't stand this.
I used to be a pest control tech and got a bed bug call. When I arrived, the guy was sitting on a bare mattress with a coffee table with a jar on it in front of him. I realized he was picking bed bugs off of himself and putting them in the jar. It was a pint mason jar, 3/4 full, and the bugs were crawling out of it
Oh, come on.
my
and
God.
back onto the guy.
Yeah, how
as
tiny
quickly-
bed bugs are?
Stop.
It's so gross.
Oh,
As
God.
quickly as he was
Okay.
putting them back in, hundreds and hundreds. I've never seen so many out in the open like that. It was a true infestation. I've got like 3 or 4 of these if you want to hear them.
Nope,
Nope.
we're good.
That's, by the way, this is the fear of bugs is called entomophobia. So,
Bugophobia.
yeah. I like your version better.
So anyway,
What else am I going to say?
so it's all about.
No, keep
people-
going. Keep going.
Okay.
This is a good one. This is horrific. Do you know how tiny bed
Oh,
bugs are?
God, yeah.
To have a pint jar where they're just overflowing and crawling out of there. Can you imagine?
and he's just sitting there.
yeah, in the middle.
They're almost impossible to
In
see.
a little, he probably
Almost.
took all the rugs and everything, and he was just in the middle of the room trying to stay away from these fucking bugs.
No thanks, dude.
Oh, it's,
Terrible.
you might have won this one.
While I was a 4th-year medical student, I was riding with an EMS team, and we picked up a homeless man.
Okay.
While en route to the emergency department, we noticed hundreds of red sores.
Oh, okay.
When
I know
asked
where
about
this
the
is going.
wounds, the man did not know anything about them. 2 minutes into the drive, I saw movement around the man's waistline. All of a sudden, 25 to 30 bed bugs crawled out of his pants and started doing their business on his belly and legs. The man felt nothing. I grabbed one bug with a towel to verify the infestation. Instantly, all 30 bugs rushed back into the man's pants. If you don't think a full-on Simicaceae infection is gross, just wait until you see one. You will itch for a month.
Yeah. Yeah, as soon as you hear that there's bed bugs in that room, you'll start itching. That happens to me every time.
Yeah.
This person has scabies, I start itching. This person has bed bugs. Yeah.
But just the imagining the guy picking them and putting them in a jar and them crawling
That's
back
the
out.
grossest thing.
That
That's
to
awful.
me,
He's
I
a
was like,
sick
I'm done.
man.
I have seen lots of cases where someone comes in and they've got a wound, a chronic wound, and maybe they live on the street or they don't get a lot of medical care, and they've wrapped it up with towels or whatever. Then you open it up and it's just full of maggots. Now the maggots actually serve a purpose. I mean, sterile maggots are still used sometimes to clean up just dirty wounds. You put the maggots in there, close it up, and they'll just work their way around eating the dead tissue until it just cleans it up real nice. And then the surgeons can go in, clean up, just do a little bit of the rest, and maybe put a graft over it or something. So yeah, maggots in wounds, and it's always that's called myiasis when that happens, when maggots infest a wound. And look up, I don't know, just. No, you know what? Don't do this. I'm going to tell you not to do this. Don't Google penile myiasis.
No, don't do it.
And when I go on a show and they say, what's the grossest thing ever, I'll tell them to Google image oral myiasis, and that always makes everybody puke.
I think I've looked that up for you before.
I think so, too. I was on Chip Chipperson's show, the one called Chip Army, Armey, and it was with Mark Normand. And I was not doing well until I started getting them to Google image some really gross stuff. And then it was a stellar performance. But up until that point, I mean, what am I going to do with Chip? You know, I'm not a funny person, but I can be a gross person. And that was what they needed. So
You're going to be funny in 2 weeks.
that's true. That's true. Oh, God, is it 2 weeks? Yeah, check out the creepoffroast.com. All the tickets are sold out. It's a completely sold out event. It'll be
They found out Dr. Steve was coming.
my
They
one
sold
and
out.
only time of trying to do quote unquote stand up, and I just don't want to suck. That's all. I just don't want to suck. And but
Well, just
I
act
do,
like you're here.
I do
Close your eyes and do it.
that's what I'm going to have to do. I'm going to do 3 to 5 minutes. I'm going to fixate on some people that I know already are predisposed to like me, and one of them is in our chat room right now, Sean Pedrick, who's going to be. He won one of the VIP seats, and he's actually coming. So, Sean, I'm just going to be talking straight to you, and you better be laughing at every joke. That's all I'm saying. That'll get me through this. 3 to 5 minutes, and I'm done. But I won't be able to drink until I've done my thing.
Right.
So I asked Vinny, just put me up front
early.
So it's at Comedy at the Carlson, September 17th in Rochester, New York, and there will be live stream, and I think it'll be free. I don't know. I mean, with Carl, who knows?
No.
Anyway, all right.
Hey, you want one from the chat room?
Yes, of course.
So Talk Like a Hicks, to use got a good one.
Okay.
So I guess they were working in the clinic, and a gal was having some
A gal.
young
It's 2022.
young
Harm.
lady,
Chick.
we're assuming abroad,
A dame, a
female,
gash.
a female had
Steve.
That's not me. I'm making fun of him. Okay, go ahead.
had what I would assume some pretty significant vaginal pain, and they started evaluating her and found some tampons that had been up there
Sure.
for a while.
I've
Pulled-
seen that a bunch of times.
Pulled 4 of them out of there.
That's
Ew.
more than I've
That's
ever
gonna
pulled out.
smell good.
Said they'd been there for over 6 weeks. Said it smelled so bad.
6 weeks.
Yep. She thought her body had absorbed them.
Oh yeah.
So she just kept cranking in
Oh,
another one.
my God.
No, this is not unheard of. Anyone that ever does primary care and does women's health, or anyone that does women's health, will have seen this at least a couple of times in their career. And
Yep.
usually what happens is the person is having intercourse on their period. They push the tampon up to allow room for their partner's whatever, and then they forget to take it back out again, or they can't grab it, and they just go out to hell with it. And what happens is there are good bacteria in the vagina, but too much of a good thing is not, is a bad thing.
Sure.
And what the bacteria just will grow and grow, and it forms kind of a slime layer on there.
God.
And it's gray, and it stinks to high heaven. And if you get it out of there, the vagina is very good at just cleaning itself out. And within a couple of days, the odor's gone, and it's back to business as usual. What I'll have some of those people do, though, is replenish the good bacteria, which is lactobacillus, with plain yogurt. Just a douche of plain yogurt. If you use a douche, you put a tablespoon in 8 ounces of warm water. That's good, and then you can just douche with that. Or you can use an applicator, like a Miselex or Monostat applicator.
Oh, okay.
And for vaginal cream,
Right.
And you just suck up the yogurt in that and put it there. But don't be stupid and use yogurt with the fruit on the bottom. You just want plain yogurt, and it's got to be cultured too. It needs to be a live, active culture, or you're just putting milk products in your vagina.
Oh, come on.
Yeah,
Well,
that's
I'm just
not good.
saying.
Yeah,
Let's
that's not
Make
good.
a milkshake.
Ooh.
Sour cream.
Yeah, creme fraiche.
Oh.
All right, delightful. All right, anything else you got there?
No, sir. I believe that'll do it.
Okay.
But we do have a
Number
question
one
we
thing,
get to, yeah.
don't take advice from some asshole on the radio.
What did you say? You had something?
Yeah, we do have a medical question here in a minute.
Okay, sure. Yeah, go.
Yep.
Well, from the waiting room.
From the waiting room.
So what the waiting room is, for those who are not listening live, is we do this around 3:30, 4 o'clock, usually on Wednesdays, sometimes Thursdays, every once in a while on Saturday. Just follow our Twitter feed at Weird Medicine, or go to our website. Go to our YouTube channel, and it's youtube.com/Dr. Steve 202, I think. But just Google YouTube, search Weird Medicine, and just sign up for notifications, and then you'll be notified. And we just kind of hang out. We don't push this. This is not a video show. We don't, people that do YouTube shows, they get hundreds of thousands of views. We'll be lucky to get 100 or 200 for something. We're not pushing that. We get thousands of listens. Well, I'm old school. This is a radio show. But this was kind of a fun thing that was proposed to us by Matt Kleinschmidt from the Laugh Button. And it's been fun, and so people can just come hang out, and then they can ask us questions live and stuff like that. And it's, Scott and I play horrible songs at the end,
But
and
it's fun. And
Richard Kish and a
it's
couple
free.
other people hang out and go, "Oh, that was good," and they
It's
just lie to us.
delightful.
They just lie.
Yeah,
You are a liar, actress, go the out.
So anyway,
Yay, my favorite show.
all right. So you ready?
yep.
Ryan has an excellent question here. Is it possible that
I'll be the judge of that.
I'll be the judge of that. Is it possible that I would have a full mobility of my forearm and it still be broken after a fall? I did this the other day, and while it's really bruised and swollen, I can still move it. Is that normal? So it sounds like
Okay, you can take this. I mean, define broken.
Yeah,
That's
well,
the thing.
that's
okay,
what
so that's what Scott. That's where Scott's going.
Yeah, that's exactly what I was going to say. Yeah, you certainly can break it, and you can have, because there's 100 different types of fractures that you have. Now, certainly, if it's a compound fracture, so the bone breaks in half and sticks through the skin.
Yeah, then that would be unlikely.
Yeah, that's going to be probably unlikely that you're still.
You'd have
living it.
some range of motion, but it
You'd-
wouldn't be good.
Yeah, the problem is it would be a dangling range of motion.
Right.
Dangler.
Yeah, that's not a good thing. But yeah, so it is. It's very possible to fall and break your arm.
Yep.
Or break. If you depending on how
You do a spiral
you have
fracture,
spiral fracture, you can
green
have
stick fracture, all
green
kinds
stick
of stuff.
fractures, hairline fractures, and all these things are very, very possible.
If you're concerned you fractured it, go see somebody.
Yep.
Let them X-ray it. Sometimes they won't see it the first time.
Yeah, especially
Go ahead,
if
Scott.
you get enough swelling and it is a green stick spiral fracture. hairline fracture, they might not see it initially on
It'll
on
start to
painful
show
X-ray.
up when it starts healing,
Yep.
right?
Yep. Yeah, because they'll start seeing the calcifications of
Yep.
the bones. So, yeah. So if you're concerned about it, I would definitely go get someone to look at it. X-rays typically the first thing they would do, and if
Yep.
they suspect more, they can do more invasive stuff.
Yep.
If it's red and swollen, it wouldn't hurt to have somebody have a quick look at it.
Yeah.
But what I like to tell people, Dr. Steve, if you think it is broken, sometimes if you'll squeeze not where the redness and the swelling is, but I identify where the bone is.
Yep.
You can actually squeeze away from where you think it's broken, and if that triggers a really sensitive spot, sometimes that means there is breaking and the bones are shifting
And they're moving.
and they're moving
Yeah.
slightly, and that can cause a lot of pain.
That's
yeah.
what causes the
Yeah.
most pain when you've got a fracture is the
Yep.
motion. And when they, if they put a rod in there, you think, oh gosh, it's going to really hurt. There's a dang rod going down the middle of my bone. But when it stops the rubbing of the
nerve endings.
pieces
Yeah.
together, it stops hurting so much. It's amazing.
Yeah, it's really an incredible thing. So yes, you can have full range of motion with a broken bone.
Yeah.
Yeah, go check it out. They got walk-in clinics.
But
that
the
are
pain
pretty-
would kind of keep you from moving it, which is what they don't want you to do, right? You don't want to move.
Well, yeah, depending on the kind of fracture,
And
but
how
like,
severe it is.
yeah, like Dr. Steve was saying, if it's a hairline or green stick fracture, if it's of the arm, range of motion isn't going to be as important to not do as if it were in the foot. So if you have
Right.
if you got a fracture in your foot and you start walking and you keep putting all that extra weight on, it'll break it and make it even worse.
Yeah.
So.
Is Lovett in the chat room
She is,
today?
yep.
Okay,
She
so
is.
Patty will appreciate this.
Patty loves it.
I used to give talks. Well, I still do. But when I have given talks about pain management in the outpatient setting, we always tell people, we're telling you this so that you'll do it safely, not so that you won't ever treat pain. Because we got people saying, well, I don't ever treat pain. And it's like, well, why don't you just say, I'm not going to treat diabetes or high blood pressure then? But there's this thing called the World Health Organization analgesic ladder. And the analgesic ladder starts with, step one has non-opioid analgesics in it, like Tylenol, acetaminophen, ibuprofen, aka Motrin, and stuff like that. Naproxen, which is naproxen, and then step two would be the things like Tylenol with codeine, hydrocodone with acetaminophen, aka Lortab or Norco, or oxycodone with acetaminophen, aka Percocet. And then step three would be the strong opioids, morphine, hydromorphone, also known as Dilaudid, those kinds of things. Now, the problem with this metaphor is it was intended to just stratify different analgesics, but when you have a ladder metaphor, how do you work a ladder? You put your foot on the first rung, then you go to the second rung, and then you go to the third rung to work your way up the ladder, right? So what the state of Tennessee at one time was saying was, well, you got to start with stage one, and then go to stage two, and then go to stage three. And I was like, you know what? If I'm in your emergency room and I've got a bone sticking out of my leg, and you come at me and say, well, we're going to start with stage one, and if that does, I'm going to sue you. So go straight to step three. It's totally fine. And so much misunderstanding out there. And the World Health Organization, I'm not a huge fan after how they handled some stuff with COVID-19 anyway. And I was not a fan before this because of the way that it's just a really unfortunate metaphor that they used to classify opioids. Okay. Just call them class 1, class 2, class 3. And you don't have to have a ladder. It's, it was someone's project, and they're all proud of it. And it just pisses me off every time I see it. But anyway, all right. I got criticized last week because someone said that, you were going way off the range, Dr. Steve. Dr. Scott had to rein you in. And I sent him back. I said, if Dr. Scott has to keep me straight, I really must have been pretty effed up. So anyway.
Well,
What?
What did you go off the range about?
I don't know. You know, I go down on these tangents all the
Oh.
time, but I just talk about things that I find interesting.
Thank
might
God
not have
Dr.
been-
Scott's here.
I know. That's what I said.
I'm sure
it was
had
probably
something
the
to s-
UFO thing.
Yeah, or you know,
I wasn't
Star
paying
Trek
attention.
or something.
Yeah.
Yeah, and Tacey just zones
She
out,
was
so
napping.
she doesn't know.
Back on
We're
track,
like,
cowboy.
get back on Facebook.
All right.
Check it out.
All right, you want to do some questions?
Let's do some questions.
Okay.
Let's not do too many. It's
Hey, Dr. Steve,
100
Matt
degrees.
Charleston. How are you?
Hey, man. Good. How are you?
Doing good. Yeah.
Good.
Hey,
Good.
so they've got this article from Neuroscience News. It says a synthetic embryo with a brain and a beating heart grown from stem cells.
Oh.
Thoughts on that?
Can somebody Google that to see if that's real? So look for embryo grown from stem cells. So what I think about this is everyone should go read Aldous Huxley's Brave New World, because that's exactly what that was about, where they were growing. They had basically gotten rid of sexual reproduction between humans, and they were growing people in test tubes for different things. Like if you were going in space, they grew them in the embryos in jars that were like rotating around and stuff like that, and they could do different things to make people more suited to the role that they had decided they would have after they were born. Before they were born, while they were in this jar, they'd say, okay, we need a bunch of laborers, so let's go ahead and we'll give them big muscles, and we need a bunch of intellectuals, we'll give them big brains and stuff like that. These people are going to have to go to space. What did you find, Tace?
Researchers from the University of Cambridge have created model embryos from mouse stem cells that form a brain, a beating heart, and the foundations of all the other organs to the body.
Okay. So what they're doing is they're doing stem cell research, saying, hey, we could do this. We could grow some things from this, but they're killing those embryos before they get too far. But there's going to be some dang nut, Island of Dr. Moreau type that's going to just go ahead and take it all the way to its logical conclusion and make a human out of that, or a pig, or something that there was no sperm, no egg, no nothing, just a stem cell. And that will be very interesting ethically, because we won't be able to stop it. We'll say, oh, well, we won't do that, and we'll sign a bunch of treaties that we're not going to create artificial humans this way, parthenogenic humans, which is what they would basically be, and or asexually reproduced humans, and we'll sign these treaties. That isn't going to stop somebody in a lab from doing it anyway,
No.
So, once they figure out how to do it, the
Especially if
cat's
there's
out of the
money
bag.
involved, buddy. You know
So
what I mean?
we'll talk about the ethics of it if we get a little bit closer to this. All right. Let's see this one.
Hi, Dr. Steve. I found your radio station on Sirius, and
Okay.
I wasn't paying very much attention.
Of course,
when
nobody does.
I heard someone call in about a supplement that they started taking from your show that
Uh-oh.
helps with cancer. And so I
Hmm.
don't know how else to get hold of you. I'm going to continue looking online.
Okay.
But if
Does anybody remember what she's talking about?
No.
I don't either. But I did find something interesting recently, that there's some data on frankincense. Have you
Yes.
seen this?
Yes, I
For
have.
colon cancer.
I have, yeah.
And the data is not bad. It's not good. I want prospective, double-blind, placebo-controlled trial on frankincense. But I'll tell you, if I get diagnosed with colon cancer, hell, I might take
Give
a
it
little
a shot,
frankincense. Yeah, it's not going to hurt. I didn't see any downsides to it.
No. Yeah, frankincense has been used for years to treat a bunch of stuff, and they have seen some, clinical stuff where it may help with different kind of cancers, specifically colon cancers.
Yeah.
It's,
let me see.
pretty incredibly strong medicine. But I'm not real sure what she's talking about. That does not ring a bell.
Okay, here we go. This is from MUSC. It says Medical University of South Carolina, not a crap
No,
university. Cancer surgeon and researcher Nancy DeMore is leading a clinical trial using frankincense to try to treat breast and colon cancer at MUSC. She's done extensive research on new treatments for breast cancer. was willing to put this to the test after she had I guess it was a postdoc that researched frankincense as a treatment of breast cancer as an undergraduate student. That was Ingrid Bonilla. And they said that this stuff called boswellic acid, an extract from Indian frankincense, may help patients by reducing inflammation. So inflammation is certainly involved in cancer. There's no question about that. As a matter of fact, at breast cancer, you can have a type of breast cancer called inflammatory breast cancer that's really, really angry. And those are usually people that are young with very active immune systems. So their study is a window of opportunity trial that takes advantage of the window of time between initial diagnosis of breast or colon cancer and surgery to remove the cancer. They will take this boswellia while waiting for surgery. I guess boswellia is the...
it's the scientific name, I think.
Scientific name for frankincense.
Right on. Yeah, I take boswellia every day.
Do you?
I sure do.
Really?
I sure do take boswellia every morning.
Why?
For arthritis, yeah.
Oh, for arthritis,
Yeah,
because it's an
inflammation,
anti-inflammatory.
For the
Why not
GLUT?
turmeric? Why don't you do that?
I do that as well.
Huh.
Hey, I'll do anything.
Well, they
to
say
not
here
have to,
frankincense
you know
would
what?
not be the only plant-based treatment for illness. No shit. About everything we have, it was originally plant-based.
Yeah.
Opioids, digoxin. I
Mushrooms.
mean, yeah, that's right. Yeah. So anyway, yeah, okay. So I'll be interested in finding that, seeing the research on that. We could go to clinicaltrials.org and see if there's any already published research. I know that there is some, and you could go and just to remind everybody, you can search the whole of the medical literature. It's totally free by going to pubmed.gov. It's PUBMED. .gov, and people go, oh, I ain't going to no government website. No, it's just the National Library of Science. It's where all the research is. The government isn't. This is one of the places where they're not curating anything in there and shadow banning things. All research that's been published that has an agreement with PubMed goes there, and it's just National Library of Science. But anyway, and that's where you're a place where your tax dollars are actually going to do some good. And but you can research this stuff. You could put in frankincense colon cancer and see if you could find a double-blind placebo-controlled study there. And I'm hoping that that's what Scott's doing right now. So anyway,
if
very
you knew
interesting.
How to spell frankincense.
I just type in boswellia.
As Frankenstein came up.
Hey, Dr. Steve. It's Andrew from Pennsylvania. How are you?
Good, man. How are you?
Good, good.
Oh, good.
Dr. Steve, I have a question about clinical vaccine trials.
Yes.
I enrolled in a phase 3 double-blind placebo-controlled study of a Lyme disease vaccine by Pfizer.
Interesting. Okay. So, will you look up the
that
Pfizer?
Was one of my, that's one of my topics today.
Oh, really?
Yeah, was the
Pfizer Lyme disease? Well, you see what kind of
yeah.
vaccine it is. Is it, since it's Pfizer, I wonder if it's an mRNA vaccine.
I know I have a 50-50 chance of getting the placebo or the medication. My question is, has anyone studied if the placebo injection of saline results in similar arm soreness as
Give yourself a bill!
Vaccine?
Yeah.
My injection site arm pain felt much like other vaccines, but I don't know if that could be the placebo effect or not.
Yeah, so this is a great question. And when I was
we had that same question.
Yeah, when I was
when
in,
we
the
were in the Pfizer.
Well, that's right. Diane and I were in the Pfizer trial at the same time. Mm-hmm. And in that one, I asked them, I said, what's the placebo in this? And they said, oh, it's saline. I went, okay, well, then I know I got the vaccine. Right. Because it caused pain that saline wouldn't do. Mm-hmm. But some of the other vaccine trials, they'll actually use things like, what was it? They used a different vaccine for the placebo. And I can't remember. Oh, shit. Well, anyway, yes, they take that into consideration. They'll use something that will cause inflammation as their placebo, and so that people can't tell which one they got.
So can he ask?
You can ask. They don't have to tell you.
Okay.
Because you sign a thing that says that you're going to, participate in a double-blind, placebo-controlled trial, and that you're not going to try to unblind it before it's time. Now, in our case, when the vaccine actually hit the market, the trial was still going on.
Mhm.
But what if you had gotten the placebo? You were like effed, right?
You're
so
hanging, yeah.
so what they did was they unblinded it at that point, and if you got the placebo, they called you in to get the vaccine. And then what they did was a post-marketing trial after that, what's called a phase 4 trial, where you look for adverse effects and good effects, efficacy, past the point that the drug or the vaccine hits the market. So anyway, that's what they did with that. So did you find out anything? What kind of vaccine is it? Is it a traditional vaccine or is it mRNA?
I haven't found that part, but what I did found, which was interesting, was the fact that this actually works. It's 3 doses and a booster, but the tick, when it first latches onto you,
yes,
it goes up. This vaccine goes up into the tick and works on the tick.
What?
And disallows them being able to put the bacteria into you. Very
What?
strange. Yeah, that's what I just read.
Okay, well, isn't that interesting? Okay,
It's totally different.
So I'm reading here that it is a antigen type. It's not an mRNA.
Okay.
Yeah, so it says the randomized placebo-controlled phase 3 VALOR study is planned to enroll approximately 6,000 participants, 5 years of age and older. Damn.
Wow.
Data from phase 2 studies continues to demonstrate strong immunogenicity in adults as well as children with acceptable safety and tolerability profiles in both study populations. But of course, phase 2 studies are very small. So you got to do the phase 3 study to tease out those rare adverse effects. So that's very interesting. All right, good. Oh, I would love to take a damn Lyme disease vaccine.
God.
It's in all 50 states now, or at least the 48 that I'm aware of.
Did you know that they had a Lyme disease vaccine back in years ago and discontinued it in 2002?
Really? Why? What
well,
happened?
It was 80%. It reduced infections by 80%.
But
the complaints of arthritis and other adverse effects is why they had to stop it. It was called Limerix.
Yeah.
Limerix.
Oh,
Limerix,
really?
yeah.
Did you?
I'd never seen it before.
That's what I found.
There
when
are
I was looking it up.
476,000 people in the United States and 130,000 people in Europe get Lyme disease
And
every year.
we see it every day. We see somebody with Lyme's. Or
What's the
somebody
symptom of
suspects they have
Lyme disease?
Lyme's.
Fever.
Fever.
Go ahead.
Well, no, I was going to say.
Go ahead,
the
genius.
the chronic part
I'm
is
just messing with
aches and pains and fatigue. I mean, terrible. Systemic muscle aches, bony aches, arthritis type of pains.
When it
And lots of
starts,
fatigue,
there's an expanding lacy. I've seen this dozens of times when I was in Vermont. Expanding red rash that gets bigger and bigger and bigger, and then it just fades away. It's called erythema migrans. And then they get fatigue, fever, headache, stiff neck, joint pains, muscle pains, and then people don't, if they miss the rash, they completely miss it. And then it goes away. And
I was going to say, it sounds like every other illness.
But right, that's right. And so people just don't
Yeah.
treat it if they don't notice the tick or they don't notice the rash. And if you don't treat it, what happens is it goes into this latent phase and then it comes back and it causes arthritis, carditis, it can, in other words, inflammation of the heart, and neuritis, inflammation of the nervous system. And so that's why we really would like to have a vaccine to prevent that phase 3 Lyme disease. Now, what other disease do we know causes a skin syndrome that then goes away and then comes back and kicks your ass later? Anybody know? Anybody in the waiting room know? Oh, we've got too much of a delay.
Yeah,
on
I'm
that
sorry.
one.
Yeah,
Syphilis. So syphilis starts as a chancre, which is a skin lesion that divides and divides and divides. It's painless, and then it goes away, and you go, "Oh, I guess I'm okay," and then it comes back as stage 3 syphilis, which can invade the brain and nervous system, stuff like that, called tabes dorsalis, and it can cause psychosis and all kinds of bad problems, and it's often fatal. So you don't want to miss that one either.
Right.
And we don't see a lot of syphilis these days, but it's easy to treat if you catch it in the primary phase. Same with Lyme disease, and the two bacteria are related. They're both spiral sort of bacteria. So, all right, horrific.
Awful.
Talked about all kinds of gross.
It's been
things.
awful.
Gross
This is
hour.
this is bad.
So he was asking about the placebo. Yeah. So okay. Well, we answered that. All right. Well, listen, we're out of time. It was quite entertaining today. It was excellent having you all in the studio. Thank you, Dr. Scott. Thank you, Lady Diagnosis. And good luck with your new position. Tacey, good luck with retirement. Thanks to everyone who's SiriusXM, whose steadfast support of this show has sustained us over the years. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. Thanks, everybody. Thank you, everybody.
Thank you.
Thank you, Dr.
Let's do
C.
podcast.
Yeah, I've got one for us for that.
Oh, you do? Okay, well, let's just do it now, then.
Okay.
All right, we'll start it.
Okay.
Podcast. Let me bring up the podcast script. Look at that. I can just push a button now. I don't have to go looking for it. I love this Stream Deck. That's where this comes from.
Number one thing, don't take advice from some asshole on the radio.
It's all right here in front of me.
I
I
was
can
going to say, I
see
like
everybody.
your Stream Deck.
That's fabulous.
That's fabulous.
I have two of them. A little one for the...
I like the big one.
No, you do? Okay. Yeah, she's a size queen. All right. Very good. I still have not heard... Well, anyway, we'll talk about it in a minute. All right, you ready?
Yes, sir.
So before we go, you got another question, Scott?
Yeah, Mark Fletcher's got a great question.
Okay. Hello, Mark.
Hello, Mark. Hope you're having a great day. Hey, so I had a endoscopy last week, diagnosed with gastritis.
Yes.
Apparently stress-induced.
Yes.
How does stress cause gastritis?
Oh, isn't that something?
That's a good question.
So you can't separate the mind from the body.
Exactly.
And when you are under stress, you produce stress hormones. And these stress hormones can increase the amount of acid that is produced in the stomach. Tacey, you've got some information on this, right?
Nope.
No? Okay. Scott, you have some information.
I
on
have
this,
lots
though.
of information.
Yeah, talk about it.
Where to begin? 50 years ago, I started having stress in my life.
Well, try talking into the microphone
no,
so somebody can hear you.
No, it's so. The way I describe it is, we all have places in our body that have weaknesses, and stress tends to really accelerate those weaknesses. Some people have headaches. Some people have neck and shoulder pain. Some people have gastritis, which is inflammation of the stomach lining.
Yep.
And what happens is, with all that stress, a lot of times extra, as you said, the stress hormones are produced, and a lot of times extra acid is dumped into your stomach.
Yeah.
And subsequently,
And you know what else happens too with stress is you decrease the amount of protective lining stuff, prostaglandins, mucus, and stuff to the inside of the stomach, which makes it even more
much more susceptible
So go
to the
ahead,
acid.
sorry.
Yeah, and it's vital that you get it treated for a number of reasons. You don't want to wind up creating a Barrett's esophagus.
Yeah.
Which is the inflammation of the
esophagus,
the esophagus, the sphincter there.
Hence
right?
the name.
The name.
Right.
You certainly don't want to wind up developing stomach ulcers, which is what I did, because I'm an overachiever. So, gastritis is a real thing, and one of the ways, Dr. Steve, we can tell people.
And gastritis just simply means inflammation
right.
of the stomach.
And we can typically we can kind of guess if they've got a stomach ulcer or gastritis based on when their pain in their
that's a
stomach
good
is.
one. Yeah, go ahead. Go.
So real quick, if you have pain immediately when you eat, or almost immediately when you eat, that's typically gastritis, because the stomach gets really irritated. Usually, if you eat and it makes your stomach feel a little bit better, typically that's an ulcer. And conversely, if you don't eat, the extra acid in there is not absorbed by the food, can make your ulcers worse. So that's the way I was trained. You may be different.
Okay,
but that's how we were
makes
trained.
I'll let you have that one.
But if you can, but as soon as that food hits that stomach, if it just blows you up, it's like, oh my! And some people don't want to eat.
Yeah.
When they have gastritis, because it causes
they get
intense
afraid to
pain.
eat.
Yeah.
We've got a kid like that.
Yeah.
So what do they do for that?
We treat it
with medicine or just herbs?
Well, okay.
Or do you just eat certain things?
Stress reduction,
meditation, stress reduction,
using the Trip app, TRIPP.com. If you have an Oculus, throw that thing on. It's clinically basically proven to decrease your stress level, at least temporarily. I don't have any data on it reducing gastritis, but it can't hurt.
Yeah, can't hurt.
And then we treat, since excess acid is a problem, you can treat people with acid reducers, either the H2 blockers like famotidine, or proton pump inhibitors, because hydrochloric acid is basically just a naked proton with a chloride ion attached to it, or paired with it. And so proton pump inhibitor, if you decrease the amount of protons being pumped into the lumen of the stomach, you'll decrease the acid by definition. I found a deep dive here as far as the pathophysiology of gastritis that's caused by stress. Stress results in the release of a thing called angiotensin II, which decreases blood flow to the mucous membrane. And that causes reactive oxygen species formation, which attacks DNA and results in 8-hydroxydeoxyguanosine formation. That's 8-OHDG for those who already know that. This results in oxidative mutagenic byproduct and subsequently oxidative stress on the mucous membrane. On the other hand, naturally produced nitric oxide is believed to protect against stress gastritis because it promotes vasodilation, or opening of the blood vessels, which would increase blood flow, which would increase repair. So that's how they would describe this in the medical literature. Not that just what you need to know is stress bad, not stress good, and that it's treatable. But gastritis better than ulcers. And ulcers obviously better than precancerous lesions, et cetera, et cetera. So on the spectrum of things wrong with your stomach, I'll take gastritis because it's the easiest to treat.
Yeah.
You don't want people afraid to eat, though.
No.
No.
And you don't want people afraid to go to the doctor or their healthcare provider to deal with this either.
Oh yeah, of course. No, totally. That's it's something you got to stick with.
Get an Oculus Quest. I guess it's called MetaQuest now, and get that Trip app. That is the thing. And they've got a free demo that you can download. And even if you don't have stress-induced gastritis, this thing is it's amazing. It takes you to another world, and you just float, and it's like being in sensory deprivation. And the president of the company reads the meditations to you. Diane, you've done this, right?
No, I've just done TM. I've not done this Oculus.
I thought you did. Well, Tacey, you've done it.
Yes, and it knocked Bobby Kelly out.
It did. Bobby.
About 30 seconds.
It's true. He was sitting on the thing, and apparently he was exhausted, and he put that thing on. It put him right to sleep.
Funny.
Ooh, I need that.
The first time I did it, they had a bug in it, which they've subsequently fixed. But I got stuck because you rise up in the air, and then you go to this next breathing exercise, and there's the light that tells you how to breathe, and you can see your breath going in and out. Breathing in is blue, beautiful sparkles, and breathing out are these sort of red, rusty sparkles, and you can see it coming out of you. It's amazing. And then the last level, you rise up and you're above the earth and you're looking down, and there, the music, it's kind of that spa music with the binaural beats that's supposed to induce a trance-like state. And then they're talking about look below, there's no boundaries, there's no borders, all this stuff, and it's all very peaceful and hippified, but it's amazing. But when I did it the first time, I got stuck. This is how I ended up working with them because I got stuck between the second layer and the third, and I thought that was what it was supposed to be. I was there for like 30 minutes, and I fell asleep, and I was just sort of looking at this weird horizon with the music going and all this stuff, and
that's cool.
I emailed customer support and said, was that supposed to happen that way? And I got the president of the company emailed me back, and I was saying, wow, that doesn't usually happen.
Wow.
So, yeah, it was cool. So, anyway,
Yeah,
Trip's amazing.
Yeah. Before we go, real quick, gastritis, inflammatory things like NSAIDs, specifically Advil.
Yes.
Oh, absolutely.
Those will blow your stomach up. So if you're taking those, find another way.
Really, if you're on aspirin, and I learned this from Tacey, if you're on aspirin to prevent heart attack and you're taking a non-steroidal anti-inflammatory drug like ibuprofen, you're actually considered high risk for GI bleeding.
Right.
and you should be on a proton pump inhibitor at minimum to protect yourself from GI bleeding, but you should be talking to your primary care provider about
Steve,
that.
haven't they decided that you shouldn't be taking baby aspirin for heart attack prevention?
Well, it depends. The USPSTF
Didn't they
keeps
change
changing it.
something?
They keep changing it all the time. And now they're saying if the benefit outweighs the risk of stroke, then you can go ahead and take it for, let me see, primary prevention. Let me look this up. I'm going to cut this part out. Okay, aspirin for primary prevention. Here we go. So this is their newest thing, aspirin used to prevent cardiovascular disease. This is from the USPSTF, which is the U.S. Preventative Services Task Force. And so they're now saying adults aged 40 to 59 with a 10% or greater 10-year cardiovascular risk. So you have to do that Framingham calculator that we've done. If you don't know what we're talking about, just Google Framingham calculator, and you have to punch in some numbers, including your cholesterol. If you don't know what your cholesterol is, you're probably overdue to see your primary care. Go get enough things to plug that in and see what your risk is. And it says if you have a 10% or greater risk and you're under the age of 60, the decision to initiate low-dose aspirin use should be an individual one. Evidence indicates that the net benefit of aspirin use in this group is small, but it's non-zero. Persons who are not at increased risk for bleeding and are willing to take low-dose aspirin daily are more likely to benefit. That is grade C evidence. It's not good. Adults age 60 years or older, they recommend against initiating low-dose aspirin use for the primary prevention of cardiovascular disease in adults 60 or older. So there you go. So I guess I need to stop my aspirin again because they keep changing this. You know, this was a new recommendation as of April. I guess I missed that. So I'm glad you brought that up, Tace.
Yeah, I thought I read that too.
Thank you.
Give yourself a bill.
All right. Actually, I knew that. I just wanted you guys to seem smart.
Thanks, Steve.
You're welcome.
You're the best.
All right. Thanks always go to Dr. Scott. And to Lady Diagnosis, welcome back. Thanks for being here. And to Tacey. And don't forget to go to our Reddit, our subreddit, and vote for who had the most disgusting story.
Remember the bugs crawling out of the jar.
Yes.
Ooh, yeah.
Or the fungus growing in the guy's bloodstream.
Which is disgusting.
That is probably, if we had a category of dumbest thing, that would be one. And then the 80-foot tapeworm that was just shitting out eggs, pieces of.
That's terrible.
Yeah, that's pretty awful too. Thanks to everyone who's made this show happen over the years. And listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. And many thanks to our listeners whose voicemail and topic ideas make this job very easy. And thanks to my niece Holly, who will get mad if I don't do a shout out at the end, even though 90% of the shout outs at the end of the show before this were basically her.
I was just totally giving you crap.
I know.
with
I'm
that.
going to reinstitute it. I just want to make you feel
God.
bad. Go to see. I was just giving you crap. Okay, well, I'll put it back in. No! Go to our website at drsteve.com for schedules, podcasts, other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. You can say, thank you. Okay, never mind.
Thank you, Dr. Steve.
Thank you, everybody.
Too late.
Thank you,
It's funnier
Dr.
that way.
Steve.
When
Thank
it's
you,
just
Dr.
me
Steve.
fade out, and I'm going, y'all can say thank you. Okay, let's do the intro, and then we'll talk to the people in the chat room.
This is no good. I'm going to drink it anyway, but I don't like it.
Okay.
Is it one of the ones I got you and you don't like it?
No. I usually
you don't
just
like what
buy
I
in the
get
good
you.
stuff.
Why did the cantaloupe go to the spa? It wanted to unwind. Why did the astrologer cross the road? To get to the other sign. What do you get when you cross a broken ice cream truck with impressionist art? Van Gogh.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine from the world-famous Cardiff Electric Network studio. First and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And back from sabbatical, Lady Diagnosis. Hello, Lady Diagnosis.
Hello, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who have never listened to a medical show on the radio or the internet. If you've got a question that you're embarrassed to take to your regular medical provider, can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at Lady Diagnosis or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking over with your healthcare provider. All right, very good. Thank you, everybody. Don't forget to check out stuff.drsteve.com for all of your online shopping needs. You can scroll down, see stuff we talk about on the show, or you can click straight through. Go to Amazon. It makes a huge difference when you do that, and we thank you for doing that. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And listen to our Patreon show. Patreon.com/weirdmedicine. It's just Tacey and me for the most part, and sometimes we have celebrity guests, and when we have those, we call that the exam room, and they actually come in, and instead of us interviewing them, they ask us questions. It's kind of fun. And do the Cameo. It's so cheap and ridiculous. I did a couple of today, and it was loads of fun. I'll do whatever you tell me to do. And I'll say basically anything you tell me to say, come on, within reason. But cameo.com/weirdmedicine. All right?
All right.
There you go.
Thank you, Dr. Steve.
Thank you, Dr. Steve.
You're the
Thank
best.
you.
You're awesomest.
You're so smart.
Yeah, well, it's me. All right, there we go. We're done.
Thank you. Gosh.
Thank you. Okay, go downstairs and drink and
Turn on the air conditioner.
I thought you were going to play music.
We are.
Okay.
Casey won't stay for the music.
No, it's too damn hot.
Okay.
I'm sorry about the wine.
No, it's okay. I'm not
You
complaining.
should
I
be.
like my wine cold. I like it red.
Okay, I like my red wine warm.
Because I'm a redneck. That's how you're supposed to like it.
You like your wine like I like my women, cold and
Sassy.
All right, I'll be downstairs. And he's like, you've got to come.
But you won't be able to hear anything if you don't put your headphones on.
I'll put it on.
What was that you started playing last week? What if this goes in tune still?
What are you talking about?
You started playing something from Waylon Jennings last week, but I can't remember.
Oh, yeah.
What it was.
Yeah. We used to play it with the with G-Bag.
Ooh.
That's
Ooh. Do you need me to scroll? Are you doing music?
Not yet. No, I'm trying. I can't think of the damn song he's playing. It's not
If you said it, I would remember it.
It's not Waymore's Blues, is it?
Yeah, Waymore Blues.
Well,
That's
it.
it.
Yeah, Waymore's Blues. Yeah.
Do you remember it?
I'm getting ready
you
to
find it.
I'm getting ready to.
Because I know it has a weird where it does.
I got my name painted on the. Yeah, that's okay. Yep. I've got my name painted on my shirt. I ain't no ordinary dude. Don't have to work. I don't have to work. Hey,
yeah, that's it.
Give me a little give me juice on it on my.
Oh, okay. Yeah. I hear it.
There you go. Well, what are you playing that run in?
Whatever you want.
Well, I woke up this morning, it was drizzling rain. Around that curve came a passenger train. I heard somebody yodel.
Keep going.
Heard somebody yodel and a hobo moan. Jimmy, he's dead, he's been a long time gone, been a long time gone.
Keep going. I'll play that part. You just play the chorus. Turn the your master volume needs to come down a little bit. There you go, because you're clipping. Okay, try that. Yep. Well, not that far. Just give me a little bit.
Yeah, and I can play acoustic. We need
No, it's fine. Yeah. We'll get a better mix this way. Okay, ready?
Well, I woke up this morning, it was drizzling rain. Around that curve came a passenger train. I heard somebody yodel and a hobo moan. Jimmy, he's dead, he's been a long time gone, been a long time gone. A long time gone. If you wanna get to heaven, got the D.I.E. Gotta put on your coat and T.I.E. Wanna get the rabbit out to L.O.G. You gotta make a cold motion like a D.O.G. Like a D.O.G. A D.O.G. Well, I got a good woman, what's the matter with me? Makes me wanna love every woman I see. I was traveling when I met her, now I'm traveling again. And every woman she sees looks like a place I came in. Like a place I came in. A place I came in. Well, I got my name painted on my shirt. I ain't an ordinary dude. I don't have to work. I don't have to work. I don't have to work. Yeah. Shirt, I ain't no ordinary dude. I don't have to work. I don't have to work. I'm a bum. I don't have to work. Woo.
There you go. Not too bad.
That's so much fun.
Can you shut up?
I love Waylon Jennings. Sorry, man. That was my best Waylon Jennings.
That wasn't bad.
Yeah, not too bad. Not too bad. No, that was good. That was a good one.
Let's do one of the songs that defy. Oh, Diane hadn't heard you do Wild Horses.
Yeah.
Oh.
Yeah.
I'm requesting Wild Horses.
Well, we've done it recently, but she's never heard you do it.
We let me see if I can pull it up, Bert.
And we're gonna do the Rolling Stones version.
Yeah. Yeah, I may need your help, Bert, Diane, or directly.
Okay.
If I can find it. I need to save it in my favorites.
I know, me too.
Wild Horses. There you go, right there.
There you go. Version 8. Or something like that. The one that's got Neb in it. That's it, yeah.
Do I just use this arrow?
Yeah, this one right there, yeah.
Oh, page down,
yeah.
okay.
Yeah, I think so. Yeah.
Okay.
2, 3, 4. Okay, you ready?
Yep.
Just play the chords. Don't try to be fancy. When we get back up here, then you can solo.
All right, go ahead. Yep.
2, 3, 4. G.
Childhood living is easy to do. The things that you wanted, I brought them to you. Graceless lady, you know who I am. You know I can't let you slide through my hands. Wild horses didn't drag me away. Wild horses couldn't drag me away. I watched you suffer, a dull and aching pain. Now you decided to show me the same. No sweeping exits or off stage lines could make me feel better. back. Let's be my back.
You missed that. We were supposed to do that 2 verses ago.
It must be like a different version. Yep.
Out to the G. Okay, I don't know what version you're looking at, but you threw in a bunch of stuff that isn't in mine.
It was I'm on number 8.
And mine goes after the FCFC.
Yeah.
It goes to the verse again.
Yep.
Then it does the chorus. Then it does the instrumental. Then it does the chorus twice, and then it's done.
No. I'm on it, obviously. No.
Are you on Ultimate Guitar?
Yep. But I'm on like version 8.
Oh, okay.
That's the one I found with the F's in it. That's the first. Actually, Diane pulled it up.
Yeah, it was
it's
me.
fucking Diane.
Damn Diane. God damn it.
Let me send you the version that we need to use.
Yeah, we'll use it. Yeah,
Thanks.
We can say, thanks for
I'm
throwing
down
it
here under the
bus.
bus.
Yes. Hey, let us know how is this down there.
Yeah, it's
fucking Diane.
Good. It is funny.
Anyway.
Yeah, that's the Rolling Stones.
This is the Rolling Stones
version
right.
done,
but we're doing it
olden in the way.
That's right,
version. Yeah.
because they messed up by not having the little FCFC instrumental thing in the middle, because I think it breaks the song up and it makes it better.
Are you going to Rhythm and Roots and playing?
Shit, no.
Because they have a jam session with
Oh,
Mike.
they do? Oh, yeah. We would be great in
you
front
should
of
take
people.
your stuff.
No.
It's like a circle of like 30 people
thank
with
you.
instruments
I
just
don't
jamming.
Want to look like a fool in front of a bunch of other people.
Oh, you would have so much fun.
Our audience here is kind enough that we live in a bubble where we can pretend like we're actually good. Did you have anything else?
Bad. Well, not terrible. No, I think that's good. That's good. Thank you, Amanda. Yes.
How about
much
that?
better.
Oh, is Amanda here?
Yeah, Amanda. Yeah.
Hi, Amanda.
She likes the. Yes, DP, you are correct. I do have the jam band gene. I'm teaching Dr. Steve.
What?
The jam band.
I'm fine with jam bands, but even they have some structure to the songs that they do. You know, one of the coolest jams, and I hate to admit it, was Dave Matthews and Bella Fleck. Have you ever seen that?
Anything with Bella's great. Anything with Bella.
There was this jam session. Let me see if I can find it for everybody, and we'll get a content strike, but I don't care. And I'm not gonna play the whole thing, but you can Google it.
CC.
Or on. Let me
We're
see
doing our best.
Here. Bela Fleck. I've seen Bela Fleck live.
Oh, no, it's unbelievable.
And Dave Matthews, who I'm not usually a fan of, but he's a very talented musician.
Oh, God.
I like his sound.
I like him, but I don't love his.
It's called Number 41. That's it. It's called Dave Matthews Band, Number 41 with the Fleck Town. It's one of the best jams I've ever seen. So it's Dave Matthews Band, Number 41 with the Fleck Tones. April 20th, 2002 in Ottawa. It's 32 minutes long, so I'm not playing it. But you guys should check it out if you like jam band stuff. It's one of the best things I've ever seen.
My buddy and I played the other night a 15-minute version of Make Me Out a Pallet on Your Floor.
You did?
Yeah.
Oh, that's it. We used to play that.
me out of town.
Start it.
Hang
Yeah.
on. Let me get up here. So you won't.
Because it starts on the 4. Make me out of bed.
Oh, I know. I'm used to it. I'm good. I'm good at it. Screwing it up. That is. I'm made of steel. Made of steel.
Nothing hurts you.
Yeah. Except for gout.
Right. Gout.
That's not a guy. Yeah. Well, that kind of sucks.
And then I can't remember how the middle.
Yes, GD.
GD, don't curse.
So it's make me out a pallet on you. Make me out a pallet on an A. Honey, make.
Oh yeah. Now what are the chords here?
So so it's going to go. That's the D, F sharp, G. Make it soft and low, and then a D. Somewhere where my G, A, D.
Okay.
Yep. Make me down a pallet on your floor. Make me down a pallet on your floor. Honey, make it down, make it soft and low. Somewhere where my good gal, she won't go. Breakfast here and my dinner in Tennessee. Get my breakfast here and my dinner in Tennessee. Honey, I get my breakfast here and my dinner in Tennessee. Told you I was coming, so y'all better look for me. So make me down a pallet on your floor. Make me down a pallet on your floor. Honey, won't you make it down, make it soft and low. Somewhere where my good gal, she won't go. Going up the country through that.
Let's do that
sea.
slow because we're not playing the same chords at the same time. So
You
so
can play
it's,
acoustic instead of electric?
Nope. No. We're not playing the same chords at the same time. So let's just do it slow.
Okay, I'm sorry.
No, I just want to run through it and make sure that we're doing it right. Okay.
You sounded right on it.
I did, but I don't think you and I were playing the same thing. So
Pretty close. I swear it is.
Sing.
Yeah.
Okay.
So we'll go.
I
Let's
just
start
wanna make
with
sure
3,
it's right.
2, 1, and G. 3, 2, and F. Make me down a pallet on your floor. Make me down a pallet on your floor. Honey, won't you make it down, make it soft and low. Somewhere where my good gal.
Whoa. That's an A there, right?
Yeah. Good gal, she won't go. Going up the country through that sleet and snow. Going up the country through that sleet and snow. Honey, I'm going up that country through that sleet and snow.
So you're not really playing the F sharp chord. You're just playing the F sharp note. Okay.
Best, yeah. I mean, it's F sharp 7 or that's close. Going up the country through that G, through the sleet and snow. D, I told you I was coming, so you better look for A for D me. I get my breakfast here and my dinner in Tennessee. Get my breakfast here and my dinner in Tennessee. Honey, get my breakfast here and my dinner in Tennessee. Told you I was coming, so you better look for me. Oh, make me down, pallet on your floor. Make me down, a pallet on your floor. Honey, won't you make it down, make it soft and low. Somewhere where my good gal, she won't go.
Something doesn't sound right still. I swear we're missing something.
You mean to email you the copy of music?
No. I want to find a better version of it.
I like that version.
That's a fun song.
CD.
No, it is a fun song, but that climb up isn't as simple as that. Let me see.
Well, you can walk it all the way up if you can move those fingers.
No, I know,
fast
but I'm
enough.
just talking about the chords.
If you can walk those fingers on that bass, you can do it. I can't.
You can do it. It's just a different chord, though, I think. Let me just look at this real quick.
Recluse. Oh, Recluse.
Whose version are you using?
Doc Watson.
Okay.
Recluse wants to come play with us. So that sounds good. We can jam together a little bit. Thank you, Kush. Kush, are you still there? You like that version of? Maybe you had a pallet on your floor.
Okay, you ready? I'm ready. It's fine. It's whatever.
Oh, come on now, don't be.
Oh, it's
No. We're missing something, but I'll figure it out on the piano, and then we'll do it. It's okay. All right, ready?
Yeah, we've got we got two more.
Well, we never played it.
Yeah. Okay, yeah, I'm ready.
We can play it.
I'm
We can
ready
play
if
it.
you're ready.
I'm ready. Yep. Two.
You just go ahead.
Three.
Dun,
Okay.
dun, dun.
Okay. 1, 2, 1, 2, 3.
Oh, make me down a pallet on your floor. Oh, make me down a pallet on your floor. Honey, won't you make it down, make it soft and low. Somewhere where my good gal, she won't go. I'm going up the country through that sleet and snow. I'm going up the country through that sleet and snow. Honey, I'm going up the country through that sleet and snow. Ain't no telling just how far I might go. I get my breakfast here and my dinner in Tennessee. I get my breakfast here and my dinner in Tennessee. Honey, I get my breakfast here and my dinner in Tennessee. I told you I was coming, so you better look for me. So make me down a pallet on your floor. Make me down a pallet on your floor. Honey, make it down, make it soft and low. Somewhere where my good gal, she won't know. You know I can't lay down on your pretty bed. I can't lay down on your pretty bed. Honey, yeah, lay down across your pretty bed. 'Cause my good woman, she might shoot and kill me dead. Oh, make me down a pallet on your floor. Make me down a pallet on your floor. Honey, won't you make it down, make it soft and low. Somewhere where my good gal, she won't go. Ah, don't you let my good gal catch me here. Hey, don't you let my good gal catch you here. Honey, if she catch you, she might stomp you too. There ain't no telling that crazy woman she might do. So make me down a pallet on your floor. Make me down a pallet on your floor. Honey, make it down, make it soft and low. Honey, where my good gal, she won't go. I've been sleeping, my back and shoulders tired. We've been sleeping, my back and shoulders tired. Well, way I've been sleeping, my back and shoulders are tired. I think I'll just try sleeping on my side. So make me down We'll work on the ending. But I love that. That's a lot of fun. Thank you, D.
You all would do great at that.
No, we wouldn't.
Jam session. Yes, you would.
No, we wouldn't.
Because there's so many people.
That you can't tell who's bad.
Exactly.
Yeah.
And there's so many varieties of talent.
Oh yeah. Well, we can, we can bring a limited amount of talent. That's for sure, can't we, Steve?
Thank you, everyone.
Thank you, guys. Yeah, we can definitely bring a limited amount of talent.
Once again, I feel
the
like
gene
my
pool.
microphone.
The gene
sounds
pool is slow. Hey, thanks,
tinny.
guys. We do appreciate you, Adam B. and Recluse.
Oh, my fucking iPass is on again.
Cool. Yeah,
There we go.
pass it on, brother.
That sound better? No. That's supposed to be flat, isn't it? Okay, never mind. There we go. Hello. Oh, well. Hello. Goodbye. Thank you. Come see us September 17th.
in
Sean, I'll see you there.
Week.
And watch live if you can. You can watch me bomb. You can watch me die on stage, and literally, you know, at my age, I'm dying. So.
Like literally. See you, boys and girls, ladies and gentlemen. Until next week, we gone.
I'll have a wedding that night, or I'd watch you.